recording. Today we're going to show you how to backfill a bladder through a Foley catheter in order to perform a voiding trial. We would perform this for patients that have had midurethral slings or any other prolapse, pelvic reconstruction surgery that we would want to make sure that a patient can void before they go home and void adequately. So these are the things that you need. You need 500 cc's of normal saline, and you need this catheter tip syringe, 50 cc's. So, but first, actually, we will open this up, and this catheter tip syringe is really going to be used merely as a funnel. So I'll remove the plunger and utilize this as a funnel. There's a cap on that you have to remove. And then let's open our water. No, normal saline, excuse me. I'll keep this closer to me. So the patient's got the indwelling Foley in there, and we will need to kind of pinch the Foley, trying to minimize how many items and equipment you need. But I'm going to remove the tape. Well, I could probably start removing the tape before I disconnect. I'll just pinch the Foley once we actually disconnect the Foley tubing. You can actually pinch it and remove it here. And then I'll attach my catheter tip syringe like this, and then showing yourself the gradations, you can balance this and then also kind of pinch this when you need to. All right, so I'm going to fill the first 50. And then unkink it to allow it to drain and also fill the bladder. Kink it again once the 50 is down. Pour the second 50. And then let it drain. And essentially do this 6 times for a total of 300 cc's, 300 milliliters. So we won't fill it completely now, but this is just purely for demonstration purposes. So then once your 300 is in, or there are some patients who can't even tolerate 300, and we would stop maybe at 200 or 250. But once we do this, you have to kink the Foley. You don't want any of what you backfilled in to drain out, but then you have to deflate your Foley balloon. And the syringe is over there. Oh, goodness. So I'll deflate. Oh, gotta keep this kinked. Deflate the Foley balloon. And then remove the Foley. Oh, I didn't fully deflate the balloon. There we go. And then within the 10 minutes, about 10 to 15 minutes, we really want the patient to void. You have to let the recovery nurse or the floor nurse know that the patient needs to void, and we have to measure their void. And we really want to see that they at least void 150 milliliters of that 300 cc's. So basically half of what you instilled, in order to feel confident that they will continue to do well at home. Thanks for watching, and hopefully this was helpful. Bye.